Welcome to LollieTasking. I invite you to join me and other amazing and inspiring women discussing our passion, work, discovering our purpose, interesting topics, and how we seem to have it all together. I hope we can motivate you and show you you can do it too, with some planning, a little bit of balance, and a dash of determination. This is LollieTasking.
Just a quick disclaimer before we get started on today's episode. This episode is released in the height of the COVID-19 outbreak. At this point, we are currently in shutdown. However, it was recorded prior to the outbreak. Speaking to the breast radiologists, they currently do not have openings for routine surveillance given social distance guidelines at this point in time. However, I do recommend that if you are concerned that you have a lump in your breast, please do contact your physician so they can refer you appropriately.
Hello, LollieTaskers. I am your host, Lollie, and I'm very excited to have on this monthly series, Afropolitan Health on LollieTasking. On these episodes, we dedicate the entirety of the show to a health topic in the spirit of renewing our body. My hope is by the end of the show, we would have educated you, empowered you, and motivated you to take action on your health. So, our topic for today is breast health. The entire show is dedicated to breast health and the prevention of breast cancer. Why is this important, you ask? Okay. Breast cancer, if you don't know, is the number one cancer that affects women and the number one cause of cancer-related death in women worldwide. In the U.S., a woman has 1 in 8 chance of getting breast cancer. Specifically, even more in African Americans, we have about 30% breast cancer mortality, which is the highest among any of the U.S. racial or ethnic group. And if you were to even compare to our white counterpart, it's 42% higher than them. So that is a lot. That is why I brought my dear friend, Dr. Modukbe Adeyefer. I am so honored she's here with us today. Dr. Adeyefer will discuss the breast health, prevention of breast cancer, and other questions that may pertain to it. Dr. Adeyefer is a breast radiology, a lover of God, a mother of 4 beautiful, intelligent, funny, and if I may add myself, amazing children, a wife to an equally inspiring, chill, and pioneering man who also happens to be a physician, y'all. So besides being a boss, babe, and all that stuff, she still loves to travel. She still loves hanging out with her family. But before we get to Dr. Adeyefer personally, we want to come back to why we're actually here on the show. Is really to talk about breast health. And I really hope that this show today inspires you and motivates you, like I said earlier, to go ahead and do what you need to do. So with that being said, welcome to the show, Dr. Adeyefer.
Hey, hi, Lola Day. Oh, should I say Doctor? I can tell you.
Dr. Lolley Day, fine.
I've known her for so long. I didn't even know that. But yeah, I'm so happy to be here and to discuss this great topic that I love talking about a lot. I do this every day.
I love it.
Yes. So I'm glad to share any information with you.
Okay, perfect. So can you tell us a little bit about yourself and your journey to become a breast radiologist, or how you came about this?
I consider it, I don't even know what to say because I never in my wildest dreams ever thought I'd be a radiologist. For some reason, while I was in medical school, of course I went into medical school and to help. I really enjoyed the sciences, and I really did not do well in arts. Like art is not my, like for a lot of us that come
me and you both.
Homes, I just did well or better in science and math. So, and my dad was a physician, and he still practices, but he was really my major inspiration. And seeing him doing it, I figured, hey, I can try it too. So I went into medicine, wanted to do primary care. And even the medical school I went to really supported us doing primary care. So the idea of radiology was almost like it wasn't even around me. It was really after my third year of medical school, and I realized that, although I really enjoyed primary care, I actually really, really enjoyed second year too. And in second year, it was more like sitting down, learning and discussing cases and see how we could help patients. So I figured maybe I could have a job that will allow me to do more cerebral thinking. And
Mhm.
I'm very good with faces, not good with names. So
Right.
find a job that kind of put everything together was what I was looking for. And so my dad said, well, why don't you try radiology? And I'm like, radiology? That's for like people that like really smart people. I was like, I don't know about that. I don't think I'm that level. And it was like, just
Girl,
try it
imposter
out.
syndrome.
I was so blessed. And so I did a rotation in Texas. Actually, I came to Houston.
Oh, okay.
And while I was in Texas, I really loved it. I was like, I loved it. I used to just go to class and lectures and just be like all into it. Whenever I was rotating, I wouldn't be the one sleeping because, they say radiology is a very boring sport to watch, but
Right.
I really enjoyed it. And while I was in that rotation, I met another woman, and she came to give us a lecture about breast radiology. And I said, hey, let me go shadow her. And I got a chance to go to MD Anderson with her
Oh,
and see.
nice.
And so she just showed me that, hey, you see patients, you discuss their cases with them in ultrasound. So it's a lot of imaging, patient contact, and I just fell in love. So I knew going into radiology, I was going to do breast. And when I came back, and I also, I had a lot of patients at Grady. A lot of women died of breast cancer.
Mm,
A lot of Black women died of breast cancer. And
right.
being in that profession, I didn't feel like it would even look like me. So that was part of
Hmm.
the motivation to actually go into breast radiology, to be able to help women of color, any women
Yeah.
with
Right.
their health.
I will say it is great and amazing seeing going to a physician and seeing someone that looks like you, who
Mhm.
understands you. And I thank God that God laid it upon your heart or even on your dad to give you that
I know.
vision.
I would have
And who
never.
right.
Yeah.
Because like when you say you wanted to do breast radio, I was like, what, like okay. But
It's
in
amazing.
retrospect, now I was like, oh, yeah,
Yeah,
that's actually quite cool.
it is
So
really.
I'm so glad you're one of the best out there. So
Oh,
like,
thank God.
so we talked about how you came into it, and a little bit I could get, but I want you to kind of like let people know what does breast health mean to you, because it means different things to a lot of different people. What does it mean to you, and also what do you think is important about breast health people should know about?
Um, I guess breast health really is just you looking at them and just seeing and understanding what it is, what it does, and also does it look healthy? I know sometimes
Right.
you look in the mirror, you look at your face, you notice a flaw in your face.
Mm,
But I think some women, even though we are very attentive to this, these two masses on our chest, we may not really understand how it functions or what it does.
mm,
So where should I have a lump, or what does a lump feel like? Should the skin be different? Should I have this, this kind of like funny looking holes, or like, we call it peau d'orange appearance of the breast. Should I be having nipple discharge? At what age? So breast health is just you understanding what the breast is about and knowing what your breast feels like. If you have any changes, see a
mm,
doctor about it.
right.
So, a person who understands what their breast should look like should know certain things, should know that my breast skin should stay the same. It shouldn't be
Mm-hmm.
changing color. It shouldn't be hot and warm and extremely painful. A mistake a lot of people make is that when they have breast pain, bilateral breast pain, they come and see us. But most time it's physiologic. We just don't have a reason, and it's usually
Right.
negative for cancer. So, extreme breast pain, focal breast pain, like pain in the same location all the time that doesn't go away. Let your doctor know about that. You shouldn't have nipple discharge that is clear or bloody. If you're having a bloody or clear nipple discharge, please go to your doctor. That could be a sign of underlying disease. You shouldn't have a lump that just kind of grew overnight and it's growing. I met a
Mm.
woman who, she came to us with almost like a 7 centimeter mass in her breast.
Oh
And
my
I
gosh,
asked
how did it
her,
get to that level?
exactly. I'm like, how long have you had this for? Oh, it's been a year. And I'm like, oh my God, no. If you
Oh
feel a
my
lump in your
God.
breast, you should go
Yeah.
and see your doctor. It's scary, but actually, the earlier we find out about this process, the better the treatment, the better the outcome. So
Right.
it's just best for you to know that if I have a new lump in my breast, please go see somebody. It
Right.
could be negative, it could be a cyst, but you're
Mm-hmm.
not gonna know by sitting at home and waiting for it to go away. So please, for sure, feeling any kind of breast lump, go see your doctor.
And I think part of it also is like, yeah, the 7 centimeter, that's a little bit much. But part of it is that a lot of us just don't know our breast. And I think it's very important that you use your face as an example, right? Like, because you look at your face all the time. If you see a little flaw in it, you're like, oh, do I need to see a dermatologist?
Hmm, hmm.
Like a lot of us are not looking at our breasts or doing breast self exams to kind of like have an idea, because we
Hmm,
do have normal lumps and bumps,
hmm,
and we
hmm.
have to know the difference between
Exactly.
just like the normal lump and bump and what is this here
Yeah.
going on. You did mention something that stuck out to me though. You said clear discharge, because a lot of people think of clear as it's okay, it's not pussy, right? If it's not pussy, then it's probably fine. Can you so you said clear discharge and bloody discharge are the two ones that are like more concerning?
Right.
Okay.
So, I mean, plus the discharge is still bad.
I mean, yes, it's still
That
bad. It
could,
means you
but it's
probably have
not bad.
infection
Yes,
and
exactly.
versus
It could be another
cancer.
line. A lot of people get nipple piercing and they get a lot of what we call subareolar abscesses. And so they
Hmm.
have pain behind the nipple. And sometimes we have to drain it. And when we drain it, of course, pus comes out sometimes.
Right.
So there are different kinds of nipple discharge. We have gray nipple discharge, bloody nipple discharge, clear, and you also have a milky discharge. So if you have a milky discharge, of course, you have to get a history. Are they breastfeeding? But
Hmm.
if they're not breastfeeding, they're young, they're older, have to, make sure that even though your breast is negative, do ask the doctor about potentially a prolactinoma, or if they're checking their prolactin levels. Because if they
Okay.
have elevated prolactin, they could end up having bilateral bloody nipple discharge, which to us as
Interesting.
radiologists is benign, but,
Hmm.
make sure other stuff is not happening. Uh,
Right.
a green nipple discharge, not really. We're not worried about that. But if you have clear, as in like almost watery nipple
Hmm.
discharge or bloody nipple discharge coming out of one orifice, a lot of times we don't realize that, our nipple has multiple holes in it where the milk comes
Hmm.
out. So you want to make sure that it's like one orifice in either breast, that you're having a consistent clear or bloody nipple discharge coming from it. And the reason why it's important is patients may have what we call a papilloma, and papillomas are very common, but some of them do end up, causing the nipple discharge. They are masses
Right.
within the ducts of the that's coming out of the nipple, and those needs to be removed because sometimes they could harbor cancer cells in them, and so that's
Hmm.
why it's important for you to talk to your doctor about it. So there could be a
Interesting.
papilloma, but there could be a papilloma that have atypical cells with it, or even have underlying DCIS or invasive malignancy.
That is so interesting. So, in the line of cancer, there are obviously different types of cancers of the breast that we can get, and depending on what they find, you're going to have to talk to your oncologist and your
Hmm,
radio or your breast radiologist about that. But even pre that, I think it's a little bit heart wrenching when I read the statistics about the percentage of mortality of African Americans. Like in the beginning of the show, I talked about how over 30% of breast cancer mortality comes from women of color. So why do you think this rate is higher in our population? Is it lack of screening? Is it just our genetics? Can you kind of talk a little bit more into that?
I have both a personal and at the same time, of course, clinical perspective to this.
Right.
I was reading a couple of articles and it was saying that the reason why could be access to healthcare, tumor biology, or just, screening, basically. Being of an African descent myself, even my own mother sometimes tells me, they're like, well, it doesn't run in our family, so we don't need to
Right.
do this, or I will not have cancer because I'm not supposed to have cancer, or of course we
I'm not
overly,
gonna stick it in the air.
exactly, overly maybe spiritualize the whole process and not
Hmm.
get adequate screening early. So a lot of the time it's just misinformation. and not knowing truly that this is important. I think at the age of 40, you should get a yearly mammogram. And the problem also, some people don't know what a mammogram is, but please, if you're going to get
Yeah.
a mammogram, Google it, see what it's like.
Right. Right.
Of course, you have devices, compressing your breast and taking a picture in different views, and this helps us to detect breast cancer. I trained at Grady Hospital, and of course, I see a lot of women, Black women, that do come to Grady, and by the time they show up, it's already too big. Some people don't have health care, they don't have health insurance, and so even though they have a lump, they don't know what to do. They're completely stunted. They don't know to go see a doctor. I think the reason why people of white Caucasian race may have better outcome is that they may have better access to care. And so if they feel anything, they're going to come in and go and they're going to get their screening done, the diagnostic workup, biopsy. They do it very much at the same time. But of course, with people that don't have access, it could be very difficult. And they end up not doing well because by the time they show up, it's very big, it's metastasized. And so I think that's one of the factors, is just the fact that we don't have access and we're not maybe giving enough information out there. So I've had to educate a lot of women, of African descent, my Nigerian mothers, that it's really not about, I don't feel anything. Most times you don't feel stuff, we actually see on imaging like, oh, I had came in just regular screening. She said, I've been having, stuff, but it's nothing. And there was a big mass there. She did not feel it. So screening is important. And so telling our women, our mothers, please, mom, or please, sisters, whatever, cousins, get your mammogram. When you're all having tea together or you're hanging out, hey, have you had your mammogram this year?
Exactly. Let's have mammogram parties.
Yeah, well, like let's go together. Sisters go together, mothers and daughters go together sometimes for the support. I mean, it's scary to go looking for cancer, right? But I feel like you have a peace of mind when you've already done it and everything is okay. Then for you to just kind of not know what's happening. And I think lastly is just tumor biology. I mean, they've also found out that a lot of Black women do have the genetic predisposition to have BRCA1 and 2. And those are genetic risk factors for developing breast cancer. And so what happened is even when we are diagnosed, we have a more aggressive form of the tumor that's difficult to treat. And so all the more why we should get screened early and consistently.
Right. I think when you talked about you having the patient that kind of came just to get a mammogram because she's supposed to never felt anything, kind of reminded me about, was it Today's Show Savannah Guthrie? Did you remember that story? Where she was basically doing something like this, talking, and she wanted to show it's easy to get it done, and she went and got screened, and she actually had breast cancer. Like, it wasn't, I'll look more into it, guys. I'm going to read more about this. I'm not sure about the particularity of the story, but I think that's exactly what happened. And there's one, I totally agree about the fact of, I see this more in the African community than the African American community, or I should say the immigrant African community, where we have this, oh, I'm a child of God. I pray to God, nothing will befall me. And my arguments, or I wouldn't say argument, my thought on that is God has given the doctors the knowledge they need to have. So we need to follow what we need to do so God can take care of the rest. So that's what I tell those people. Um, but with that being said, another thing that also stood out to me when you talked about was like, at 40, you should be getting your mammogram every year. And I know we talked a little bit about this before the show, but there's a lot of discussions out there about African Americans, given that we have higher risk of breast cancer, or death from breast cancer, and risk from breast cancer. Like, should we be doing screening earlier? I just want you to talk to that.
Yeah, there are some new studies that just came out that, of course, African American women, we have this difference from biology and we're at a higher risk at some point. And they recommend that you should at least start risk assessment at 30 years old, meaning that if you're hearing this podcast, you're in your 30s or early mid 30s, you should have had this discussion with your doctor. So you guys can discuss, hey, do you have a family history of breast cancer? And if you do, let's start the screening early. As in, like, if your mother or grandmother had breast cancer at 45. then at 35, 10 years earlier, you too should start screening for breast cancer. We shouldn't wait till you're like 40. So I think the new recommendation for people of color is that, hey, start discussing your risk assessment early, and from there, determine if you want to take it, start it early, as in
Okay.
35 or higher. If you are 40 years of age, please just get started every year.
Right. Right. And is it appropriate to ask for a baseline study? Let's say, okay, you're like 35 or 37, and God forbid you had a family member, not maybe not even a family member, a close friend, just for your own sanity to have a baseline screen. Is that appropriate, or is the recommendation strict, like you have to get it at 40?
No, I work in a community right now where a lot of doctors actually send their patients for baseline at 35.
Okay.
And if everything looks good, then they can always come back at 40. But I also tell the patient once I see them, hey, it looks good. I don't see anything. But if you feel any lump, don't tell me you just had a mammogram. Still come
Right.
back and see me. And all this stuff we just talked about breast health, I discuss with my patients. And so if they
Okay.
see any of that stuff, do not wait until 40. I have seen patients with breast cancer at 28, at 25, at 30, at
Mm-hmm.
35, and so and usually they're very aggressive, hard to treat, and they just don't do well. So if you feel any change at any age, come, come see us. Talk to your doctor. Let's get a mammogram or ultrasound.
Okay. In the line of still kind of talking about like going to get your mammogram, some of us that are listening to this could be like, yeah, I'll go get my mammogram. That's easy. But I'm thinking about, again, a lot of people in our community that don't have access to health. Are there things or places people can go online to see if they could get free mammograms? Or I know breast awareness or breast cancer month is October, I believe.
Yeah, it's October.
I know they do a lot of things during that time. Are there things that we can tell people to check out that way they can at least get a free screening somewhere?
Of course, I think every community has something that you can like look into. I live in Houston, and we have the Rose, and they actually do offer free screening, but you have to qualify for it. So
Okay.
I think looking in your area about breast imaging, breast screening, and seeing what they have to offer when they offer it. That would be good, because I do know that without health insurance, it could be kind of costly. And
Hmm.
so, if you cannot afford to do it, please just look around your area to see if anyone is offering a free or subsidized screening in your
Right.
area.
Right. Yeah. So basically, what Dr. Madukwe is trying to tell you is that even though, yes, it may be costly, there are things out there. Don't just stop at I don't have insurance, I'm not getting screened. Like,
Mm-mm.
talk to your doctor. It all starts from talking to your doctor. Breast health is part of our overall general health. This is another reason why we should be seeing our doctors every year, even if we're perfectly fine. And we should talk to our doctors about it, because you may not even know some of the resources your doctors have and they can give to you, or something about the community that a doctor knows about and they can pass it on to you. So never let money be a reason not to get a mammogram. Go
Oh,
ahead.
and also, your insurance pays fully for you to get a screening mammogram. So it's actually covered on your
Ah,
mammogram. So every screening, at least the screening component, is covered by your insurance. And the diagnostics, like, if you get called back with ultrasound, that might be coming with a copay, but your
right,
screening is free under your insurance. I'm not free,
right.
but at least covered in your insurance. So if you do have insurance, you should be able to get a mammogram every year. There shouldn't be any
Okay.
reason why you cannot get it. But if you cannot afford to get it, some people can't even see a doctor to get a
Mm,
referral to get a screener.
right.
But those places that do free screening, they want to know that even if they do your screener, who's going to get the report? They need to be a doctor
Exactly.
to get the report. So that's usually a problem too, as well. Sometimes those particular places do have doctors that have their screeners referred to them, and then you follow up with
Okay.
that doctor. So just kind of see what's around you, and be surprised by the opportunities around that can help you.
There. Perfect.
Mhm.
Um, so like me now, Yes, I'm gonna talk to my doctor. I'm gonna get my baseline screening done. Check, 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 check. But other people also want to know, like, are there things I could be doing by myself also to reduce my risk of having breast cancer? Um, I know a couple of this, but I just want you to talk about what are some common risk factors that you guys have seen associated with breast cancer, the ones we can change, the ones we can't change. I think it would be great to kind of for people to hear about.
I have a lot of patients, and some of them are like vegetarian and they exercise 24/7, and they still get breast cancer. And you have patients that are, might not be living the sort of quote unquote, healthy lifestyle, and they just
Right.
strolling at 85, nothing.
Mhm.
But there are some things that they've done research about that shows that can reduce your risk of breast cancer. And of course, proper weight, not smoking, all that stuff. But I think the number one factor to getting breast cancer is being a woman. Being a woman,
We can't change
you
that.
can't change that, right? Being a woman, you are
Not even with
predisposed.
surgery. Your genetic is your genetics.
Yes, you were just made that way. So being a woman is the number one risk factor for getting breast cancer. And of course, your genetics. So if you have genetic issue in your family whereby like a lot of cancers, not just breast cancers, but just cancer in general. And of course, familial history, then you probably need to get screened for that genetic abnormality. So if every woman in your generation, in your mother generation had breast cancer, you should get screened for BRCA1, 2, P10, TP. I mean, they're just
Like
different genetic.
genetic causes.
Yeah. So
Yeah.
you should get screened. And quite frankly, your insurance can pay for that now. So talk
Okay.
to your doctor about that. Hey, my grandmother, great grandmother, my mother, my aunts, please, it's offered. Go ahead and just get it done.
Yeah.
So that's one thing you could definitely do to help yourself. Just be knowledgeable, because if you're knowledgeable, then you could take care of yourself properly. So if you have the gene, it doesn't stop life. It just means you get screened more. You get
Right.
the annual mammogram, and of course, 6 months later, get MRI. And if you're done having children, you could decide, hey, let me get a bilateral mastectomy, as in remove both breasts or remove both ovaries. If you have the gene. And so there's a whole specialty of people who actually take care, and they discuss this with you, and they can help you make a good decision. So
Right.
information is power. And so the more you know about yourself, your family, the better off you are. And of course, eating healthy, exercising, do the best you can, live your best
Right.
life, and get screened. If you get
Right.
screened and you find something, then we can tackle it early. It's always a pleasure to meet cancer at zero point 0.5 centimeter or zero point 0.4 centimeter. It's never
Mhm.
so fun when you're like, ooh, it's 3 centimeter, or it's 4 or 5. It's fun getting through the skin. It's got lymph nodes. I mean, at that point, it's just
Oh no. Yeah.
very,
It's
very
really
bad,
bad.
very
Mhm.
bad. So just not neglecting that part of your physical health. Don't jog every day. Be on a nice lean diet, and you forget to get the screening mammogram.
Exactly.
I say you add it
Uh,
there.
that is so funny. I think what you're trying to say is, I'm sure they get it, but what Dr. Modukbe is trying to say, in case you didn't catch that, is yes, she's not saying don't get healthy. If you're not overweight, it reduces your risk. If you exercise, it reduces your risk. If you're not smoking, it reduces your risk. If you eat healthy foods, it reduces your risk. However, don't sit here talking about I'm a healthy person, so I don't need to get screened. You will be shocked about how many healthy people still have breast cancer. So just because you should be healthy, yes, it reduces your overall risk, but it doesn't reduce it to zero. So it is still very, 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 and if I may add one more, very important to get your screening. So, one question I always wondered, I don't know, maybe it's just nosing me. Like, is there any difference in one, breast cancer risk if you have a breast augmentation, aka implantations? And two, does it affect the screening if you have a breast implant?
A lot of women have implants. You'd be surprised. Shoot, a lot of us have it. But we do have a way of imaging despite implants. So when we do implants, you do have to take more pictures,
Okay.
but that's okay. We take the implant in place and displaced views. So we have a way of pushing the implants back and pulling the skin out and be able to take a picture in different planes to help us diagnose cancer. And it doesn't really affect us still.
Okay.
But if you have implants, we're not going to bust your implant. People always think, oh my God, they're going to crush my implant. No, we're not.
Mm.
We have hardly ever does it happen. I mean, there's a very tiny risk, but hardly ever does it happen. The mammotechs are really good at doing this. We do this all the time. So, no, it doesn't affect your risk. If you have augmentation, mastopexy, as in like a lift, we can tell by your image if you've had
Right.
surgery. So don't worry about that. Still come. We could still diagnose despite any kind of augmentation, implants, or anything of that nature.
People always ask, is there like a test I could just test besides? I know you talk about like the genetic test. Is there a test people can just take to diagnose breast cancer?
No.
Like a blood test. So no test, okay? Except if you do have genetics, like if you know like there's so many people in your family, if you're like, oh, breast cancer runs in my family. If
Hmm.
you're saying that, then you probably should get the genetic testing to evaluate that. But besides blood tests, I know there are also other modalities that can be used to evaluate for breast cancer. You mentioned MRI.
Hmm.
Can you just talk about a lot of like maybe either? I know we talked about mammogram a lot, but I know you could do just regular ultrasound, MRIs, or other modalities or new modalities that may be coming out that you guys use and when and why.
Right now, the number one way of screening for breast cancer is with mammogram, and that's your first line defense is mammogram. If you have, that's what the reason why I'm talking about this high risk is because if you are high risk, then that means that if you're having genetic screening done and you do have breast cancer, you can actually add MRI with your mammogram to increase the sensitivity of detecting breast cancer. And
Okay.
so that is really more for people that are high risk, the
Okay.
MRI. The other issue we haven't talked about yet is dense breast. We found
Right.
that about 40% of women have dense breast tissue. I have to explain this a lot to my patient because what that means is that when you get a mammogram, we see a gradient of black and white. That's kind of like the simple way of saying it. And if you have dense tissue, you have more whiteness in on your mammogram. And cancer
Mm,
usually occurs and looks like this white
why?
density. So
Right.
white on white density makes it difficult for us to see cancer. So we could still miss cancer even though you got a mammogram, it's negative. The cancer could still be hiding behind this tissue. Technology has been so good to us that we have discovered and we have a new way of at least screening called tomosynthesis, and that way we can actually scroll through the breast tissue, and by scrolling through, we can detect more cancer that was
Mm,
overlapping with the breast tissue. So one more thing, if you're going to get screened, please add 3D to it. Just say 3D. We know what you're talking about. And your
okay.
insurance should cover it. A new law just passed that, that should be covered with your insurance.
Okay.
And so with 3D, you can actually see better through dense tissue. If you have a fatty breast, it means that there's more black against, compared to the white tissue. And so cancer
Mm-hmm.
being white in a black background, boom, you can see it so well.
Right.
So that's why, if you see in your mammogram that you have extremely dense breast tissue, heterogeneously dense breast tissue on your report, it means
Mm-hmm.
that you could benefit from adding ultrasound as additional screening because when you come for ultrasound, the color changes are different.
Right.
You can tell a little bit that the tissue is kind of a gray color to it, and then the cancer or abnormalities look more like a black ball or something like that. This
Mm,
abnormality, it stands out a little bit better. So your
right.
mammogram could be negative, but you come for ultrasound and I see a 3 centimeter cancer or
Oh,
2 centimeter.
wow. That's
Yeah, it's
scary.
completely blurred by a dense tissue. And so adding ultrasound definitely does help with the process.
So if I were to come to you now and you did my initial mammogram and you see I have a dense tissue, would you automatically recommend I do other studies, or
I
what's
do
the
not.
next step?
I try not to say that unless you put in your report that you have a family history. So
I
if you
see.
say you have a family history and you have extremely dense breast tissue, I have a um, like something I always say.
Zero,
It's like
zero
living like
limit.
power scribe. I get
Yeah.
one almost every time, giving you a heterogeneous dense breast tissue and your genetic predisposition. Consider getting a risk assessment done to see if you will qualify for MRI, and if not, ultrasound. Because that those kind of population, I want to make sure that I'm not missing anything. So
Is
it's
there a,
mhm.
sorry, go ahead.
That's actually in the bottom of our reports usually.
Okay. Is there a way to know, like, if you have dense tissue? Is it just me pressing and my breasts are hard, or is there a way to know if you have a breast of a dense tissue or not? This is literally me
Mammogram.
just asking, just
Just get a
mammogram.
mammogram.
Okay.
Yeah,
You
because
can't be like my breast sticks up, it's dense, or it flops down, it's not dense.
oh, you were very surprised. People that are, a little more voluptuous, like they just bigger breasts, they could
Yeah.
have a lot of dense tissue, and some people could have mostly fatty tissue. And you could be very skinny, and you think, oh, I have, dense tissue. You don't. Now, of course, if you're very slim, you probably don't have a lot of fat, and so you're not going to have a lot of fatty tissue, and you may end up having extremely dense tissue because you don't have any fat in your
Right.
breast or on your body. Period. So definitely the only way I can know is through a mammogram.
Okay.
Yeah.
All right. So we've been talking about this. We've actually learned a lot. This is fantastic. Thanks a lot, Dr. Madukwe. Uh, but before we go, like we talked about the importance of screening, and whoever is listening to this, I'm sure your ears have perked up, and you're like, I'm going to go get my mammogram, or if I'm not at that age yet, or if I'm not at 30 yet doing my risk assessment, I'm going to talk to my sisters, I'm going to talk to my aunt, my cousins. What are some things we can do to make sure our families, our friends, our community understand breast health, breast cancer, so we could reduce the stats? Like, this stat is just really sad. And my hope, and I'm hoping through this podcast I'm doing, kind of helps, spread the word a little bit and bring it. What can everybody out there can do to help bring down the statistics in our community?
I think we just need to talk more, talk to each other, and ask questions, and maybe even see commercials and posters and billboards and
Mm.
anything at all. We should discuss it. Like, for example, I've done a lot of talks in churches, I've done radio, and whereby people just discuss this information. We just don't know sometimes, and we don't
Right.
know, and sometimes people don't trust either. And so, just having the information out there and sharing it, it would definitely increase us getting there and getting our mammograms done. I think a lot of, like, for example, our group of friends, we should be checking on each other. Hey, have you had your mammograms
Hmm.
done?
Exactly.
And you're like, well, I'm scared. I don't want to go do it. But hey, how about I go with you? You know,
Right,
you may
right.
not be in the room with me, but at least you're right there. So
Yeah.
leaning on each other would definitely help us get the word out there. It's always best if we diagnose breast cancer very early. It's always best. I tell my patient a lot that, okay, fine, worst case scenario, it's a zero point 0.5 centimeter cancer. They go ahead and do a lumpectomy, maybe radiation. You may not need chemo. But it's better because guess what? In 5 years, you could potentially be here. And if you don't get this
Wow.
taken care of, 5 years from now, you may not be here. But you just
Exactly.
never know. So it's always best to just kind of get it done early. Find it early. That's the whole point, is to just get it done early.
That was a perfect summary of today's discussion. I don't even think I need to go ahead and add any more. So we're going to do our round of questions,
Mhm.
okay? So we talk about breast health. We've talked about breast health for the past 40 minutes now, but we want to bring it back to you,
Mhm.
okay? In the spirit of lolly-tasking, we got to bring it back to lolly-tasking. Um, what are some actionable tips? First, this is some actionable tips. I'll edit that out. These are some actionable tips that I want the listeners to kind of like learn a little bit about you. Okay.
Okay.
So number one, what is one pearl? I feel like I know it already because we've said
Mhm.
this like 1,000 times. That is important about your specialty and can help save a person's life.
I'm sure we've already discussed this, but let me just recapitulate. Is the fact that do your own breast exam,
Oh, we
please.
didn't even talk about breast exam. That's true.
Well, like I said, everything's on Google nowadays. So
Yeah.
if you don't know, if you want to see it, just say breast exam. And it's important because you're going to be the first to notice a lump. I have a lot of patients that come to me and they're like, "Oh, I feel this," and then we'll put a marker over it. We take an image, and of course, we do see an underlying mass. Most
Wow.
times, it could be a cyst, which is very common among premenopausal women. And so, hey, that's okay. It's a cyst. That's fine. It's benign, 100% benign. You're good. But if it's a true lump of mass, you just saved your own life. So please
Hmm.
do your own breast examination. And you might say, "Oh, I'm lumpy bumpy every day, all day." That's okay. At least you know where those lumps and bumps are so that if you feel
Right.
something new that's hard, that's getting bigger over time, hey, come see us. Go to your doctor, get a referral, get a mammogram done.
Okay.
So,
So what is one thing that you were shocked to learn about your specialty and where you when you got into it?
oh man, it's an amazing job. I wish I could tell more women to do breast
I
imaging.
know.
It is amazing. I have like two cool friends that are in breast imaging with me, and we're just so blessed. It's a wonderful job. It's got great hours, if I must say so myself. There's really never truly a huge emergency.
Right.
And then at the same time, you really get to take care of women. You get to go to work. All my techs are women. And then all my patients usually are women. I do have a couple of men. Yes, men can get breast
Women
cancer.
women empowerment.
I love anything women empowerment. I love it. So the chance,
Hashtag LollieTasking.
any opportunity I get to be around women, to talk to them about their health, it's just a blessing. So as a breast radiologist, I never imagined it would feel and be this way, and I'm very glad. I'm very, very, very glad. I feel so blessed to do it.
I'm very happy for you. I can see you really love what you do. And there's nothing when
Love it.
people ask me about, oh, what can I do? I'm like, find what you love to
Mhm.
do and get paid for it. So that when you go to work, you're like, I can't believe they're paying me for
I
this.
say
You
that
know.
every day. I say everybody knows how much it is. They were like, I'm like, I will probably do this. I mean,
Yeah,
it
yeah.
is it is a huge. I mean, I love it. I absolutely love what I do.
So in the beginning, we talked about your amazing husband, Dr. Daya. So how are you guys able to balance your life as a physician, actually dual physician family, or both doing your respective things that you love and still have a life?
My husband and I, we picked very, very, um, I would say, wonderful specialties. I'm radiology and he's anesthesia. And so when we were dating and before we got married, we wanted a job whereby like we can go in there, do 100%, but then when you leave, we leave. And
Right.
so radiology and anesthesia, we get that opportunity to kind of just, when we're there, we're 100%. But when we get home, we can like lay back and just hang out with the family.
Getting called on
And yeah,
call and all that
no,
stuff.
no, 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 no. When he gets
See,
home,
Duke didn't tell me this ahead of time. I'm gonna just
I
tell
know.
y'all now.
You know what? I didn't know, but like, I don't get called. So, but he
Right.
still does. He still sits in the hospital actually.
Right.
But I don't, and so I'm still able to be at home with my kids every night. I'm able to go to a lot of their functions, and so it allows me to have at least that flexibility. And
Right.
also, I think fundamentally, we look at our career differently. I think our career fundamentally does not define us. We have a different center, a different route that kind of keeps us grounded. And I think that is why we're able to figure out a balance in it all. We are physicians, but it's not all we do, and that doesn't,
Right.
you know,
It doesn't define you as a person.
it doesn't. So we have a lot of different things that we do. We have four amazing children. I don't know what I was thinking when I had four kids, but
Hey.
I'm like, can I think this through? But no,
You were thinking you're a superwoman. That's okay.
no, I don't know. Now I'm thinking about it, but I guess because I had them so early, it's easier.
Yeah,
But
yeah.
uh, the careers that we chose that definitely helped us to be able to manage and do such a thing. But at the end of the day, we all consider it a blessing.
Yeah.
to do what we do. So.
Okay. So, and the final and last question I'll ask is, what's your favorite quote? And this could be a quote, a scripture, whatever.
hmm Well, my favorite quote, and I have said it in different ways before. It's in the Bible. It's Philippians chapter 4, verse 13, and it's, "I can do all things
That
through."
was mine. Keep going. Sorry.
I can do all things through Christ who strengthens
That
me.
is me.
I mean, only God, man. I cannot underplay that. Only God, because there is no way I would be able to do what I do, given the ability to even do what I do, and the grace to do what I do. It's really through Christ. And like I said, that is basically what I try to use to define me, and that's what helps me get through it. And yes, I sometimes I say it's not rocket science, man. I got to figure it out, but it's really God.
Uh, re- uh,
it,
God will
it,
figure it out.
yes, I am just here trying to do what He brought me here to do. So that has been my mantra since I can remember.
That
It's
is that
right.
is fantastic.
Yeah.
Oh my goodness, that is amazing. So guys, as you guys have learned, breast health is very important. I hope we have inspired you, we have empowered you. And as soon as you get off listen to this podcast, I really need for you to call your doctor, go get a mammogram, call your friends, have a mammogram party. We have to get the statistics down. With that being said, thank you so much, Dr. Duque, on your insight on breast health and prevention of what we can do to prevent breast cancer in our family. Do you mind just letting the listeners know if they wanted to get in touch with you, how they can contact you? Do you have an Instagram or they can
Yeah.
call me? Like, what you want?
I dabble on the Instagram.
Instagram.
My Instagram name is Mutukwadiefa, actually. So
Okay.
it's just my full name, Mutukwadiefa. And Facebook, likewise, too. I'm very boring. I should really come up with more fancy names, but it's just Mutukwadiefa.
All right, so I'm
And
gonna add it. Yeah, I'm gonna add it to the show notes. So if anybody feels the need to contact you, they can also contact you. So with that being said, thank you for joining us for another inspiring episode of LollieTasking. Like I said, we'll have Dr. Adeyefa's show notes on there, all her information on there, everything about the show will be in the stuff. Is there anything else you wanted to say before we sign out to the LollieTaskers?
Yes, it was a great pleasure, and I really hope this information does help you. And please get back to us if it does. I think we'll really like to hear about it. Thank you so much for having me.
All right, awesome. I hope you guys have done an amazing rest of your day. If you want to be empowered by daily health tips, you can always follow us at Afropolitan Health on Instagram. Also, don't forget to follow us at LollieTasker on Instagram and also at LollieTasking on Facebook. Till next time, remember, you can do it too with some planning, a little bit of balance, and a dash of determination. This is LollieTasking.
Thanks for hanging out with us in another inspiring episode of LollieTasking. If you have any questions or topics you would like for us to discuss, please contact me via lollytasking.com, or better yet, you could just send me a direct message on Instagram at LollieTasker. If you've liked what you've heard today, what are you waiting on? Just go ahead and click that subscribe button, rate and leave a great review on iTunes. And of course, do share with your friends. Till next time, this is LollieTasking.